Hello viewers, welcome to Health Matters with Dr. Udeme Denis. Today we'll be looking at the novel coronavirus. This will be my outline. We'll be looking at the introduction, the epidemiology, mode of transmission, symptoms of the disease, commonly asked questions, prevention and protection, and then the conclusion. As a way of introduction, coronavirus is a very large family of viruses that can cause illness ranging from the common cold to more severe diseases like SARS, known as the Severe Acute Respiratory Syndrome. It is worthy of note that the novel coronavirus is a new strain that has not been previously identified in humans. Coronaviruses are transmitted between animals and humans. That's to say, they are zoonotic in nature. There are speculations that bats are the sources of the Wuhan coronavirus. Epidemiology. In December 2019, the city of Wuhan in Hubei province, that's China's 7th largest city, comprising of about 11 million residents, became the center of a pneumonia outbreak of unknown cause with global implications. Later in early January 2020, Chinese scientists isolated what is now known as the novel coronavirus from the patient groups in Wuhan. On Tuesday, the 10th of February 2020, the WHO named this disease caused by the novel coronavirus COVID-19. Infections of the virus, which originated in the Chinese city of Wuhan, have been reported all around the globe. Now let's look at the picture in Nigeria. Nigeria and Sub-Saharan Africa's first confirmed coronavirus case was an Italian man who flew into the country. As at 16th of May 2020, the time of this presentation, the total number of confirmed cases in Nigeria was 5,621, with 1,472 patients discharged and 176 deaths from the virus. Mode of transmission. Very early in the outbreak of this illness in Wuhan, China, most of the affected patients were linked to a very large seafood and live animal market, which suggested animal-to-person spread. However, in the following week, an increasing number of patients reportedly had no exposure whatsoever to animal markets, indicating ongoing person-to-person transmission. Transmission from person to person is through direct inhalation of respiratory droplets from infected individuals. What happens? When a person who has coronavirus sneezes or coughs, there's release of respiratory droplet into the environment, and someone that stands close by can inhale this droplet and then become infected with the virus. It is also worthy of note that it can be transmitted by touching surfaces that are contaminated with subsequent contact with mucous membranes like the eyes and mouth. So if you touch any surface that is contaminated with the virus and then you put your hands in your eyes, your nose or your mouth, there's a very increased risk of contracting the illness. What are the symptoms of this disease? Symptoms of COVID-19 can include fever, cough, shortness of breath, and then in very severe cases, infection can cause pneumonia or breathing difficulties. Now let's look at the questions that are commonly asked. Number 1, are hand dryers effective in killing the novel coronavirus? The answer is a big no. Hand dryers are not effective in killing the virus. To protect yourself, as you will see later on, you will need to frequently clean your hands with an alcohol-based hand rub and wash them with soap and water. Once your hands are cleaned, you should dry them thoroughly by using paper towels or a warm air dryer. Another question commonly asked is, can ultraviolet disinfection lamp kill the virus? Now, ultraviolet lamps should not be used to sterilize hands or other areas of skin, as the radiation coming from this can cause skin irritation, so it's not advised at all. How effective are thermal scanners in detecting people infected with the virus? Thermal scanners are effective in detecting people who have developed a fever because of infection with the virus. However, they cannot detect people who are infected but are not yet sick with fever. So what the thermal scanner does is that it detects fever. It doesn't detect the virus. So if it is fever caused by the virus, it will still detect it. But however, in people who are yet to come down with fever, the thermal scanners will not detect, because the incubation period of the virus is about 2 to 10 days. Can spraying alcohol or chlorine all over your body kill the virus? No. Spraying alcohol or chlorine all over the body will not kill viruses that have already entered the body. Spraying such substances can be harmful to clothes or to mucous membranes. Can cold weather and snow kill the novel coronavirus? Now, there is no reason to believe that cold weather can kill the novel coronavirus or other diseases. The normal human body temperature remains around 36.5 degrees Celsius to 37 degrees Celsius, regardless of the external temperature or weather. Can taking a hot bath prevent the novel coronavirus disease? Taking a hot bath will not prevent you from contracting COVID-19. As we have already said, your normal body temperature remains around 36.5 degrees Celsius to 37 degrees Celsius, and this is regardless of the temperature of your bath or shower. Actually, taking a hot bath with extremely hot water can be very harmful, and it can burn your skin. Another question commonly asked is, can the novel coronavirus be transmitted through goods manufactured in China or any country reporting COVID-19 cases? Now, even though the novel coronavirus can stay on surfaces for a few hours or up to several days, depending on the type of surface, it is very unlikely that the virus will persist on a surface after being moved, traveled, and then exposed to different conditions and temperatures. However, if you think that the surface may be contaminated, it is advised that you use a disinfectant to clean it. And then after touching it, you need to clean your hands with an alcohol-based hand rub or wash them with soap and water. Now, another question commonly asked is, can the novel coronavirus be transmitted through mosquito bites? To date, there has been no information whatsoever nor evidence to suggest that the novel coronavirus can be transmitted by mosquitoes. As we've already seen, it's a respiratory virus which spreads rapidly through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. Mosquito does not transmit it while biting someone, so it's not transmitted through mosquito bites. Can pets at home spread the novel coronavirus? At present, there is no evidence that animals or pets such as dogs, cats can be infected with the novel coronavirus. However, it is advised that you wash your hands with soap and water after coming in contact with pets. The vaccines against pneumonia protect you against the novel coronavirus? No. Vaccines against pneumonia such as pneumococcal vaccine and Haemophilus influenza type B vaccine do not provide protection against the novel coronavirus. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine for this virus. Another question commonly asked is, can regularly rinsing your nose with saline help prevent infection with the virus? The answer is no. There is no evidence that regularly rinsing the nose with saline has protected people from infection with the novel coronavirus. Can eating garlic help prevent infection with the virus? Even though garlic is a healthy food that may have some antimicrobial properties, however, there is no evidence from the current outbreak that eating garlic has protected people from the virus. Now, does the virus affect only older people, or are younger people also susceptible? That's another question commonly asked. People of all ages can be infected by the novel coronavirus, though older people and people with pre-existing medical conditions like heart disease, diabetes appear to be more vulnerable to becoming severely ill with the virus. Are antibiotics effective in preventing and treating the virus? The new coronavirus is a virus, and therefore antibiotics should not be used as a means of prevention or treatment. Another question commonly asked is, are there any specific medicines to prevent or treat the virus? To date, there is no specific medicine recommended to prevent or treat the new coronavirus. Now, can COVID-19 be caught from a person who has no symptoms? It is worthy of note that COVID-19 can be transmitted by people with no symptoms. In that case, we call them asymptomatic carriers. They may have maybe just mild symptoms, and as such, you may not notice anything abnormal with them. But if they have the virus in them, there's a tendency and the possibility of transmitting the virus to others. Some reports have indicated that people with no symptoms can transmit the virus, although it is not yet known how often it happens. WHO is assessing ongoing research on the topic and will continue to share updated findings. Now, what should I do if I have come in close contact with someone who has COVID-19? If you have been in close contact with someone with COVID-19, you may be infected. Close contact here means that you live with the person, or you have been in settings of less than 1 meter from those who have the disease. In these cases, it is best to stay at home. However, if you live in an area with malaria or dengue fever, it is very important that you do not ignore symptoms of fever. So you seek medical help, and then when you attain the health facility, please wear a mask if possible. Keep at least 1 meter distance from other people, and do not touch surfaces with your hands. If it is a child who is sick, please help the child to stick to this advice. And then if you do not live in an area with malaria or dengue fever, do the following. If you become ill, even with very mild symptoms, you must self-isolate. Even if you don't think you have been exposed to COVID-19 but develop symptoms, then self-isolate and monitor yourself. You are more likely to infect others in the early stages of the disease when you just have mild symptoms. Therefore, early self-isolation is the key. And then if you have the symptoms, what do? You have to self-quarantine for 14 days. If you have definitely had COVID-19, that you've been confirmed to have had the disease by test, you need to self-isolate yourself for 14 days even after symptoms have disappeared, as a precautionary measure. It is not yet known exactly how long people remain infectious after they have recovered, but please follow national advice on self-isolation. Another question commonly asked is, how can we protect others and ourselves if we don't know who is infected? Now, practicing hand and respiratory hygiene is very important at all times, and this cannot be overemphasized. It is the best way to protect others and yourself. When possible, maintain social distancing at of about 1 meter from others. This is very important, so you don't stand very close to someone who is sneezing or coughing. Even though people may not exhibit the symptoms, it's very important that you maintain a physical distance with everyone. Last but not the least, people also ask, how long does it take after exposure to COVID-19 to develop symptoms? The time between exposure to COVID-19 and the moment when symptoms start is commonly around 5 to 6 days. It can range from 1 to 14 days. Now let's quickly look at basic protective measures against the novel coronavirus. Take care of your health and protect others by doing the following. 1. Wash your hands frequently. Now, regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. The reason why you need to do this is because Washing your hands with soap and water or with alcohol-based hand rub will kill the virus that may be on your hands. Now, number 2, you need to maintain social distancing. You need to maintain at least 1 meter distance between yourself and anyone who is coughing or sneezing. Why you need to do this is because, as we've already seen, the virus is transmitted through respiratory droplets. So when someone sneezes or coughs and you stand close by, there's the possibility and the tendency to inhale the virus. So you need to maintain social distancing. Number 3, avoid touching eyes, nose and mouth. Now, many of us are very fond of doing that. Why do you need to avoid this? When you touch your eyes, nose and mouth, there's the possibility that you must have contacted the virus from a contaminated surface with your hands. So at the point of touching your mucous membranes, the virus will be transmitted into your body and can make you sick. And I don't think you want to be sick with this virus. Then practice respiratory hygiene. You have to make sure that you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then you have to dispose of the used tissue immediately. Why you do this is because the droplets spread virus. By following good respiratory hygiene, you protect yourself and the people around you from the virus. Another thing is to practice food safety. Even in areas experiencing outbreaks, meat products can be safely consumed if these items are cooked thoroughly and properly handled during food preparation. You need to wash your hands with soap and water after touching animals and animal products. You need to avoid contact with sick animals and then with spoiled meats. Sick animals and animals that have died of diseases should not be eaten. You need to use different chopping boards and knives for raw meat and cooked foods. You wash your hands between handling raw and cooked foods. If you have fever, cough and difficulty breathing, please seek medical care early. Then you stay at home if you feel unwell. Then what are the protective measures for persons who are in or have recently visited areas where COVID-19 is spreading? Please follow the guidance outlined above. Stay at home if you begin to feel unwell, even with mild symptoms such as headache and slight runny nose, until you recover. If you develop fever, cough and difficulty breathing, seek medical advice promptly, as this may be due to respiratory infection or other serious conditions. You need to call your healthcare provider on time so that you can get immediate response, and then you will get the necessary help when due. When you wear a mask, you must know how to use it and dispose of it properly. How to put on, use, take off and dispose of a mask. Before putting on a mask, clean your hands with alcohol-based hand rub or with soap and water. After that, you cover your mouth and nose with the mask, and you make sure there are no gaps in between your face and the mask. Also, it's very important to avoid touching the mask while using it. If you do, please clean your hands with alcohol-based hand rub or with soap and water. You need to replace the mask with a new one as soon as it is damp, and do not reuse single-use masks. To remove the mask, remove it from behind. Do not touch the front of mask. Discard immediately in a closed bin. Clean hands with alcohol-based hand rub or soap and water. In conclusion, novel coronavirus is preventable. So let's join hands together and fight this pandemic so we can get our lives back. Thank you for your time. Remember to spread the message and not the fear associated with the virus. Thank you. Please stay informed and stay safe. Kindly share as well as subscribe and like Health Matters with Dr. Udeme Denis. Thank you. See you in our next video.